Hi everyone, welcome to Pathology collection. Now, in this short video, we will study about ABCD of hairy cell leukemia. That is, what are hairy cells, its pathogenesis, its cytochemistry, prognosis, and treatment with the help of easy mnemonics and beautiful pictures. Okay, and we'll try to revise all this in a short glance. Now, coming to this beautiful picture of bone marrow biopsy, in this we can appreciate the tumor cell arrangement in a characteristic honeycomb pattern. Now coming to what is hairy cell leukemia, it is a rare chronic lymphoproliferative disorder of mature B cell origin. Here what happened is the accumulation of abnormal B cells. How this abnormal B cell looks like. These abnormal B cells look like this. This is the feature of this abnormal B cells. It will have a hairy like projection over the cytoplasm, and that we can better appreciate over the phase contrast microscopy. Okay, and when we look into the nucleus, we'll get a slight indentation. Okay, finer indentation also. It's larger than the size of a normal lymphocyte. This is the feature of this abnormal B cell. These are abnormal, that's why we are getting this kind of feature in the B cells. Now, with the help of this boy picture, we'll remember it has a male predominance, and B for boy, we'll remember the important mutation we get in hairy cell leukemia, that is VRAF V600E mutation. And this young guy is of 20 years. Just imagine he is of 20 years. So CD20 expression is strong in this hairy. When we suspect any leukemia, first thing we do is bone marrow aspiration and bone marrow biopsy. Okay, in the case of hairy cell leukemia, on aspiration we get a dry tap, D for dry. This is the D stand for D for dry. This dry tap is because of increased bone marrow fibrosis that happens in hairy cell leukemia. And this is the picture showing biopsy, bone marrow biopsy of hairy cell leukemia. Can you comment over the cellularity? Yes, you can. This is a hypercellular. This is a hypercellular smear. This is totally looking as a clearly blue cells. All these blue cells are tumor cells. And this is another picture of bone marrow biopsy of HCL. Here also it's of increased cellularity. Hypercellularity is there. Now coming to the another feature of hairy cell leukemia, that is fried egg appearance. This fried egg appearance here in this beautiful picture, you can see this appearance, this nuclei and clear space, nuclei and clear space. We all can appreciate this. You know, this type of arrangement in this appearance is known as fried egg appearance. Now coming to the cytochemistry of HCL, it's a very important. How we'll remember this? Hairy cell leukemia. Hairy cell leukemia means full of hairs, long hairs. It get entangles and trapped. So the trap enzyme is important in this case. When we do the trap stain, we'll get a red dot like appearance like this. And this trap enzyme antibody can be used in immunohistochemistry also. And we have studied that hairy cell leukemia is of B cell origin. So B cell marker will be positive like CD19 positive, CD20, CD22. Some specific markers are also positive in this like CD103, 25 and 123. How you will remember this 103 is interesting mnemonic you can make. This guy is having 3 hairs like 1, 2, 3, 103. Okay, or else you can remember it simply like CD103 is finding positive in hairy cell leukemia. Cyclin D1 overexpression and annexin A1 is an important marker for HCL. And how we'll remember this annexin A1? We'll write the hairy cell like this. This AI will see at annexin A1 or D1. Now coming to the molecular analysis of hairy cell, already discussed B for boy, B for BRAF V600E mutation located on 7q24. And for the diagnosis, we'll use the polymerase chain reaction and NGS. Now coming to the differential diagnosis of hairy cell leukemia. Hairy cell leukemia, splenic marginal zone lymphoma, splenic diffuse red pulsed small B cell lymphoma, B prolymphocytic leukemia. Some variants are there, lymphoplasmacytic lymphoma. These are it. What happened? No, why we are this is a differential diagnosis. Okay, I'll explain you. Splenic diffuse red pulp small B cell lymphoma, all are B cell lymphoma. है ना? These hairy cells in the bone what happened in the bone, these hairy cell get accumulated like this, and this goes to the spleen. When it goes to the spleen, there also the accumulation happen inside the red pulp, and these leads to splenomegaly. Okay, this leads to splenomegaly of the person. This is the diagnosis feature of HCL. So this is the differential diagnosis. Now coming to the complication. In this, the WBC counts are pancytopenia is there, no? Pancytopenia, all the counts are reduced. So decrease of WBC leading to the infection, decrease of RBC, anemia, leading to the decrease in platelets, bleeding tendency will be there. And due to this accumulation of hairy cell inside the skeletal, it will lead to deformity, especially in the head of the femur. Now coming to the prognosis. Overall prognosis is fine in the early stage. The treatment is purine nucleoside analog, and the drug is cladribine. How will remember this cladribine? HCL, hairy cell leukemia, and this C stand for cladribine. Alpha interferon and lastly splenectomy is the choice. In case of resistant to purine analog therapy, monoclonal antibodies are given like rituximab, anti-CD22 immunotoxin. So we have completed the treatment, also prognosis. Now we'll try to revise the hairy cell leukemia in a short glance. Okay. What is ABCD? Earlier I told you, today we will study about A, B, C, D, E, F, G like this. A for annexin A1. Okay. B for BRAF mutation. C for cladribine. D for dry tap. Fried egg appearance. Okay. And one thing is increase in gas. Okay. Thrombocytopenia, it is very commonly found in HCL, and patients have the low blood count. Pancytopenia, tartrate resistant acid phosphatate stain is the most accurate diagnostic stain in HCL. But this annexin can't be used in case of MRD, minimum residual disease, because this annexin can stain myeloid cell and some T cells also, so we can't use. This fried egg appearance, we have remember the nuclear perinuclear clearing, annexin A1 most specific, dry tap due to increased reticulin fibrosis. This boy picture, cyclin D1, he loves to cycle, cyclin D1, annexin A1, CD20 overexpression, and BRAF mutation, and male predominance, 3 hairs, 103, and the cytoplasmic projection. This is all about hairy cell leukemia. Thanks.